This is Emmy Hutchins speaking for our 124 Safety and Technology assignment, and my topic is preventing HAIs, which are hospital-acquired infections. HAIs are infections that patients get while receiving treatment for medical or surgical conditions. So that means anytime a patient is admitted somewhere and they get sick, falls under the category of an HAI. The most common types of HAIs include catheter-associated urinary tract infections, surgical site infections, bloodstream infections, pneumonia, and C. diff. All types of patients can get hospital-acquired infections. It doesn't necessarily have to be old people, but they are the highest. They do have the highest percentage of HAIs. HAIs occur in all types of care settings, including acute care hospitals, ambulatory surgical centers, dialysis facilities, outpatient care, and long-term care facilities. HAIs are a significant source of complications across all sorts of care and can be transmitted between different healthcare facilities. Risk factors for HAIs can be grouped into three general categories: medical procedures and antibiotic use, organizational factors, and patient characteristics. So that means depending on what they're getting done and what their use of antibiotics have been in the past, and what kind of condition the patient is, can all change the amount of risk you're at as getting an HAI. So the prevention and reduction of healthcare-associated infection is a top priority for the U.S. Department of Health. It is also a Healthy People 2020 goal to bring down the amount of HAIs reported. So my facility doesn't have any I couldn't find any specific knowledge on preventing HAIs in general, but they do have a lot of infection prevention. They use standard precautions in all situations, with all patients. They have airborne precautions, contact precautions, and droplet precautions they'll all be put in place if they need to. However, they do have two strategies to prevent the most common types of HAIs, which are urinary tract infections and catheter-related bloodstream infections. So their strategy to prevent catheter-related bloodstream infections is they evaluate the catheter insertion site daily and check the dressing. They also date the insertion site, so you're able to check how old it is. And then they also not only evaluate the insertion site, they clean it daily also with the chlorhexidine wipes. And their strategy to prevent UTIs, which is the second most common HAI, is they remove the catheter immediately once it isn't needed, and they only insert catheters for appropriate indications. When I spoke with the nurse educator, they didn't have any patients currently with a catheter at our facility, so I didn't even get to go talk to a nurse about a patient-specific catheter. My facility has a super strict hand-washing policy and also has a policy on fake and artificial nails because they have been known to carry extra diseases. My clinical site personally doesn't have any, besides documentation, super cool technology and technology that they use to prevent HAIs. However, a lot of hospitals now use ultraviolet light to kill germs in surgical rooms and in rooms where patients have had very contagious HAIs in them. So the ultraviolet light kills the germs due to different wavelengths in the UV light, which is pretty cool. The technology kills pathogens but is harmless to patients and staff, which means the hospitals can continuously disinfect isolation rooms, which is a big bonus in preventing HAIs. So the regulatory agencies are the CDC, which regulates that, is the main one, and then also the Office of Disease and Promotion, Disease Prevention and Promotion. And the goal, the Healthy People 2020 goal regarding HAIs is that they hope to reduce the amount of HAIs by 75%, specifically those caused by central lines and catheters, which is the two types of HAIs that my clinical site has policies on. My conclusion is my clinical site monitors these safety strategies by constant documentation, as in documenting when a catheter is put in, when a catheter is taken out, when the patient starts getting symptoms and when the patient doesn't. As far as they are considered, they believe the procedures are working because they have a very low rate of HAIs at the facility. I have not seen any of the safety measures I've discussed put in place because they don't have any current catheters or central line, so I wasn't able to witness them. But I did speak to a nurse on the floor that has been, and they say that their policies on HAIs seems to be working really well. So that's HAIs. Thank you.